Today we're going to be talking about hypertension and how you could deal with it in a non-drug manner, very unusual manner, very cool manner. And we're going to talk about vagus nerve activation in order to deal with hypertension. Today's video will be dedicated to looking at science, published science on the instrument that I promote, vagus nerve activation instrument. I want to start producing more content on that instrument, actual scientific findings. And let's get started. My name is Dr. Mikola Rashik of Meragenomics, and this video is sponsored by a company called Parasim that makes devices for activation of your vagus nerve that are approved for medical use in Europe. And just a quick note to you guys, those of you who might be interested in purchase of this device, I normally offer a discount link in my video description, but I can tell you that temporarily, for a matter of maybe days to few weeks, as of right now, when the video is released, the company offers greater discount, maybe double the discount than what I normally offer. So potentially take advantage of that, because it's fairly costly device. The reason why is because this company actually attained approval for medical use, that certification, which is very difficult to achieve. And this is one of the reasons, as I mentioned in my prior videos, why I am very much interested in this particular device. Now, I'll get to tell you very cool data, and a lot of you mentioned, hey, give us a summary of what you're finding first. And the take-home message is that yes, use of this device did help with hypertension. So very cool stuff. Now, hypertension is a global problem. We all know this, high blood pressure, but specifically the study focused on young people. And what the study mentioned is that young people are increasingly exhibiting hypertension. So the high blood pressure, apparently 1 in 8 people now in ages of up to 40 years old, between 20 to 40 year olds, now show hypertension, which is obviously an issue. This was not the case in the past, and apparently they have limited capacity to be treated for this. Now, the article did not explain as to why, but vagus nerve activation could be an interesting potential solution that is easy to use and fairly simple to achieve. So why even consider vagus nerve activation to deal with your high blood pressure? So, couple things. So why does high blood pressure actually even start in a person? It's because the sympathetic nervous system, the component of your autonomic nervous system that is responsible for the fight or flight biological responses, it leads to vasoconstriction or constriction of your blood vessels, and that results in high blood pressure. And the reason why people exhibit this is because they no longer have proper balance of their autonomic nervous system, meaning the balance between the vagus nerve, or which makes up the vast majority of the parasympathetic function of your nervous system, the part of your nervous system that relaxes you, versus the sympathetic one, the one that puts you in that fight and flight mode, right? And you have overactivation of that sympathetic nervous system. Another issue that is observed when you see this is also that the walls of blood vessels can thicken over time as well, also leading to blood pressure. So that's reason number one, historical reasons known from the past as to why that vagus nerve activation could be a good target. But there's also lots of data now coming out in terms of using vagus nerve activation for dealing with atrial fibrillation. And atrial fibrillation, the article mentioned, is a form or symptom of autonomic nervous system dysregulation. And the conditions that fall under that, get this, was, well, atrial fibrillation itself is a condition that is a form of dysregulation of your autonomic nervous system. Another one they mentioned was was ventricular arrhythmias, another one was heart failure, and one more was ischemia and reperfusion injury. Now, what is that? Ischemia is where you block a blood vessel, so you no longer have blood coming in and oxygen coming in. And then once you unblock it, you have flooding of the blood, and paradoxically, this too much of a sudden blood flow can also cause injury. So all of these can lead all of these issues can lead to atrial fibrillation, and vagus nerve activation has shown to help with this. Now, not just any vagus nerve activation, they specifically refer to this form of activation as low level tragus stimulation. Now, what is tragus? Tragus is this part of your ear. The reason why you can stimulate that electrically to activate your vagus nerve is because vagus nerve will innervate that part of your ear, and it's that low level tragus stimulation that has been shown to help reduce not just the frequency but also the severity of atrial fibrillation. So that's the background, and these guys wanted to test this in young people. So they had 40 volunteers, 21 in the intervention group, and I think 19 in a control group. Maybe it was the reverse, but I think that's how it was. And they tested them for 3 months with this low level transcutaneous or tragus stimulation. And the control group, they clip the device to the earlobe. There is no vagus nerve there, so it's just sham. It's placebo. And they did it for 3 months for 60 minutes per day. And what's also interesting is how they did it. They wanted to test what is the threshold of pain, and the device, I didn't bring it with me because I was using it last night in order to fall asleep faster, because I knew I'm going to the mountains today to record, and then I left it on my bed. But the device itself, it has numbers, and these numbers provide you the information on the intensity of the electrical stimulation. And they met, so it's from the description in the article, it sounds like we're describing exactly the same type of device that now you can buy. And they mentioned that the number 20 and above were the threshold where some people might have felt a form of pain, because once you start sending electrical impulse, it's like, feels like pins being touching your skin. So eventually, if you go high enough, it can be painful. And so 20 and above, people were seeing it painful, but nobody felt anything below 70, or 17 and below. Nobody felt anything at all. So they couldn't feel the stimulation at all, even though the stimulation was taking place. So they decided, in order to fall into that criteria of low level stimulation between the numbers of 17 and 19, specifically for this purpose, in order to achieve the aims of the study. And what they wanted to see is whether that high blood pressure would reduce after 3 months of use of this device. And the type of blood pressure they were looking at, obviously they were looking at both the systolic and diastolic blood pressure. So systolic is the high numbers, that's the blood pressure when the heart pumps blood through your blood vessels to the body, and those numbers were anywhere between 140 to almost 160. 159 millimeters of mercury is the units that are used for that purpose. And for the diastolic, anywhere between 90 and 99. All right, so now let's take a look at the actual data. And in the first figure, you see the effect on the systolic blood pressure, and you can see both groups were being reduced, the control group as well, which is labeled as CG, as well as the intervention group, IG. And you can see that the intervention group, the people who were activating the vagus nerve, was way more rapid decrease. And then you see that on the left hand side. On the right hand side, you see 3 sets of bars, and the bars basically tell you the amount of change between each month. So the first bar is the change from the start until the end of first month. The second bar is from end of first month till end of second month, and the last bar is from end of second month till end of third month. So that's the progression, and you can see that both the control and the intervention group showed same change in the very last month. So the authors accounted for that. Look, there is no vagus here in the earlobe where the control group was using the device. Therefore, this has nothing to do with vagus nerve. This has to do with people doing lifestyle changes as well and educating themselves through the program of this intervention as well. And this is why you see the control group also benefiting over time, but clearly you see the intervention group benefit more. And of all these month changes, only the very first month was statistically significant. Now, diastolic change, blood pressure, you see similar pattern. There's drop of that in both groups as well, but none of these changes were statistically significant when compared from month to month. And the last thing they also measured was heart rate, and then heart rate measurements stayed the same throughout the entire duration of the study, so we're not going to bother with that figure. But they did something else. They also wanted to see what happens if we account for age and gender, and they decided to do this, and they showed that indeed, if you account for both age and gender as well, then it is statistically significant that people will see drop of their blood pressure below 140 over this time period of 3 months if they use that vagus nerve intervention. And they did it by showing odds ratio. Now, what are odds ratio? It's in essence shows you what is the likelihood that one group will see a certain event over the other group. And in this course instance, the event is the drop of blood pressure over the certain period of time. It's very similar to hazard ratios that I often talk about, especially in my cancer videos. It's the same thing, except that hazard ratio also incorporates time span versus odds ratio does not. So if you have odds ratio of 1, it means there is no difference between the two groups that are being studied. And if you have odds ratio of more than 1, then it indicates that there was greater likelihood of observing that event in one group over the other. And if it's below 1, it means it was reduced likelihood of observing that event in one group over the other, right? And the odds ratio for people who use vagus nerve intervention, that low-level vagus stimulation, as they called it in the paper, was their odds ratio was 14 or almost 14, meaning they were 14 times more likely to observe drop of blood pressure below 140 if they use that intervention than not. So, and this time was statistically significant. They also looked at gender, and it looked like men were less likely to see this effect compared to women, but this was not statistically significant, and age had no difference. And the last thing that I'll mention is that they also looked at the safety record, and the take-home message here is that only 2 people reported throughout the study reported an issue with using the device, and that was recording feeling of itchiness on the site of use of the device. That's a very common side effect being described, and that of course dissipates over time. And absolutely no one reported serious side effects. And this is a very common mantra from all of these studies. I've made numerous videos about the safety of vagus nerve activation via such devices. Their serious side effects are extremely rare, and in this case, nobody reported anything during the study. So awesome, fun study on the device itself that I use and that I promote. The study itself, also wanted to let you know, it was done last year in China. And again, check out the link below if you're interested in obtaining the device at a greater discount than you would normally obtain via purchasing using my link anyway. So I'll see you guys next time, and don't forget to spend time outdoors and take care of your vagus nerve, because as I keep always saying, the quality of your vagus nerve determines the quality of your health, because the way I see it, your vagus nerve is the barometer of your health. So keep that in mind, and there's many different ways on how you can take care of your vagus nerve. The device is one way. There's also numerous natural ways to do it. And by the way, I'll mention this, I finally have found a way to naturally also attempt to activate my vagus nerve. I struggle with this because of lack of focus. You need to focus and meditate for quite a bit of time to do this, and you do it via breathing pattern as well as humming, hence mantra meditation, because you can make the om sound. And I found a way, and that's when I'm driving to the mountains, I can actually focus to do it. I've wanted to do it naturally besides the device. Obviously, I have the advantage of using the device to cheat and do it like instantly, right? But I finally found a way, and I wanted to share that with you. All right, see you next time, and you guys have a great day. Bye, everyone.